Yeah, we are live now, bro.
Okay, yes, perfect. We are live.
Let me check the live on the group.
Yes,
Yeah, you are live now.
perfect.
Let me share the live in my page. Okay,
Okay, perfect. We are live.
let me check. Okay,
Perfect.
let's go, bro.
Let's go. Let's go.
Let's go.
I begin introduce the Excellence in Endodontics group. As
Yeah,
speaker tonight, we have Dr. Abderrahman El Kholi,
yeah.
and this is our group. We are a lot of members, so if you want to share your cases to learn more about, please join our group. In the conference, we will speak about different thematics. This night, Dr. Recoli will speak about ultrasonics in endodontics. These are our sponsor. First one, platinum sponsor is Zark. Okay, as golden sponsor, we have Denjoy. This is a brief video. As silver sponsor, we have Dexis and Coxo. And as sponsors, we have Ramo Medical and iTeeth. So we invite you to join the group, of course, and we have some prizes by joining the group for people who join the group. So many people, more people that you invite, you have more possibility to win different prizes as endomotors, obturation systems, apex locator, rotary files, and a lot of other things. So you can win 8 different prizes, and you have to remember 3 things. The first one is to join the group. Then you have to invite at least 3 new colleagues, of course, who belongs in the dental field. Then you have to write your name, your FB account name, of course, and the name of 3 members that joined the group to fill the Google form. So at the end of the competition, we will extract some member, and we will have 8 different prizes. This night, Dr. Abdelrahman Hilkholi will talk about ultrasonics in endodontics. It's a great pleasure for me to introduce our silver member, Dr. Hilkholi. He has a master's degree in endodontics. He is an assistant lecturer and endodontics specialist in the Department of Endodontics, Faculty of Dentistry of Suez Canal University of Egypt since 2016. Dr. El Kholi received his bachelor's degree in oral and dental medicine from the Faculty of Dentistry of Suez University in 2014. He was one of the top 10 students. He was awarded for his achievement by the faculty and the Egyptian Dental Syndicate. Dr. El Kholi has limited his practice to endodontics in 2016 at Alterac Dental Center. Dr. El Kholi gained very good experience and knowledge that enabled him to manage difficult and complicated endodontic cases. In addition, he has a great passion in teaching endodontics, and he has the dream of being an international lecturer and a researcher. He has attended many international endodontic conferences, including the Pan-Arab Endodontic Conference in Egypt in 2017 and Pan-Endo Conference in Egypt in 2019. In addition, he has attended many advanced courses in endodontics supervised by pioneers and legends in the field. Dr. Helholi presents two excellent cases on social media, which reflect his excellent skill and great passion in endodontics. In 2021, Dr. Helholi won the Post of the Year in the Excellent in Endodontics Facebook group, which promoted him to join the group board as silver member. With such excellent records, Excellent in Endodontics group is pleased to have Dr. Helholi as a speaker in our sixth conference. So let's start, Dr. Alcoli. The stage is yours.
Okay, thanks so much, bro. Thanks for
My
the
pleasure.
great words.
My pleasure.
Thanks so much. Thanks, Excellence in Endodontics. Thanks for the opportunity to be here, to be live with our members in the group. It's a great pleasure to participate in such conference. Okay, Vincenzo, can you share my screen, please?
Oh, of course. Here it goes.
Okay. Okay. Tonight's webinar is about ultrasonics in endodontics. Webinar by me, Abdelrahman Al-Khouli. I am an assistant lecturer of endodontics in Faculty of Dentistry, Suez Canal University. I'm also silver member in the Excellence in Endodontics. It's my pleasure to be a silver member in this group. We are reaching about 100,000 members. We are very happy by recording these numbers. We invite all of you to like and share our group link. Okay. So let's start. I will start by the outlines, introduction, piezoelectricity and magnetostriction, history of ultrasonics in endodontics, biophysical effects of ultrasonics, classification of endodontic ultrasonic tips, guidelines for use, application of ultrasonics in endodontics. Let's start by the introduction. Okay, what's the meaning of ultrasonics? Ultrasonic frequencies are those oscillating sound pressure waves above the limit of the human hearing ranges, which range from 15 to 17 kilohertz. So ultrasonics are higher than this limit, which ranges from 25 to 42 kilohertz. Okay? What about the sonic frequency? The sonic frequency which we can hear is about from 6 to 8 kilohertz. Okay? Ultrasonic vibrations can be produced by two ways. Number one, piezoelectricity, and number two, magnetostriction. These are the ways of production of ultrasonics. Okay, what's piezoelectricity? It involves the application of the electrical energy on a piezoelectric material to produce a mechanical clinics, we have an electric device called the electric scaler. The electric scaler works by the electrical energy, which works on the piezoelectric material to produce a mechanical energy within the ultrasonic tip. Okay. Most of the devices in the market are piezoelectric devices based on the piezoelectricity. They produce oscillations. Oscillations means vibrations between 28 to 36 kilohertz. Okay. This is about the piezoelectricity. What about the magnetostriction? Magnetostriction is the application of the electromagnetic energy on a ferromagnetic metal strip, which causes dimensional changes that transfer to the ultrasonic tip in a mechanical energy. The use of the electromagnetic energy on a ferromagnetic metal strip, which causes dimensional changes, which can be transmitted to the ultrasonic tip in a mechanical energy. Okay? Magnetostrictive units operate between 18 to 30 kilohertz. Okay? Okay, which is better, piezoelectricity or magnetostriction? Magnetostrictive devices generate more heat than piezoelectricity, which is a harmful effect. So we prefer piezoelectric devices as they produce less heat than magnetostrictive devices. Another one is the emission of electromagnetic energy from the electromagnetic devices, which could be contraindicated with patients having pacemakers. Okay, so we prefer piezoelectric devices over the magnetostrictive devices. As I said, most of the devices in the market are piezoelectrically based. Okay, so let's move to the history of ultrasonics in endodontics. The history of ultrasonics in endodontics. Richman was the first one who talked about using ultrasonics in endodontics. In 1957, he used the ultrasonics in root resection. Followed by Martin in 1976, who used the ultrasonics in irrigation activation, as it increased the bactericidal efficiency of the irrigation. And Dr. Gary Korsh, who designed the first retro tips, the CT tips, for the retro end preparations during episectomy in 1990. Okay, these are Dr. Gary Korsh tips, the CT tips, 4 tips. Okay, used for retro preparation. Okay. Okay. Let's move to the biophysical effects of ultrasonics. What do ultrasonics do? What do they do? They cause vibrations, which we call oscillations. Oscillations means vibrations by the mechanical energy produced by the electric device. When we apply these vibrations or oscillations in irrigation, they cause what we call acoustic microstreaming and cavitation. Acoustic microstreaming and cavitation are terms used when we apply ultrasonics in a liquid. They cause acoustic microstreaming and cavitation. Okay. Also, another effect is the heat. Okay. What about the acoustic microstreaming? What is the meaning of acoustic streaming? It's the movement of the fluid in a vortex-like motion, the eddy flow around the file when pressure waves are projected through it. As we see here, you can see a lot of waves around the file, like the waves of the sea. And also you can see the antinodes and the nodes around the file, and we will talk about it. Okay, as you can see here, the ultrasonic tip is activated, and you see the nodes and the antinodes of the irrigant, the shape of the irrigant around the file. These nodes and antinodes explode, like you see here. Explode. This explosion causes pressure. This pressure causes the irrigation to penetrate into the internal tubules and enhancing its effect. Okay. As you see here, you are seeing here nodes and antinodes of irrigant around the file. These nodes come to explode, and causes pressure into the irrigant, which causes the irrigant to penetrate easier into the dental tubules. Okay. The second one is the cavitation. What is the meaning of cavitation? Oscillations or vibrations generate gas-filled bubbles. These bubbles collapse and explode, and causing localized areas of pressure. These areas of pressure cause hydrodynamic forces, which enhance the penetration effect of the irrigant and enhance the removal of the adherent matter and the smear layer. Okay? We are talking about the acoustic streaming and cavitation. When you apply the ultrasonic tip into a liquid, you can see a gas-filled bubble which can explode and collapse, causing localized areas of pressure, which will cause hydrodynamic forces, which facilitate the removal of adherent matter. Okay? The last effect is the heat. Ultrasonics produce heat due to friction. When you apply ultrasonic to any wall or any surface, it produces heat. Is this heat good or bad? Many studies talk about warming the sodium hypochlorite inside the canal, and concluded that internal heating or the internal warming of sodium hypochlorite enhancing the bactericidal effect and the effect of sodium hypochlorite of the endoorganic component of the pulp. So heat here is very good option. Oh, what about the bad effect of heat? As when you use the ultrasonic without cooling or without water cooling, or using the ultrasonic at high power setting or heavy contact, you can cause excessive heating. This excessive heating can cause damage to the periodontal status. Okay? This excessive heating can cause damage to the periodontal apparatus. As the heat rises, the periodontal ligament will be necrotic. Okay? So take care when you use the ultrasonic to be in a light touch, light contact with water cooling and at a low or a medium power setting. So you can get benefit from the heat without harming the periodontal ligament. Okay? So what about the classification of endodontic ultrasonic tips? What about the classification? We can classify ultrasonic tips according to the material into stainless steel and titanium. Stainless steel and nickel titanium. What about the coating? They can be classified into coated or non-coated ultrasonic tips. The coat may be diamond coat or zirconium nitride coat. The coat can be diamond coat or zirconium nitride coat to increase the cutting efficiency of the ultrasonic tip. Okay. Ultrasonic tips also can be classified according to the water port, either with water port or without water port, which helps in cooling the ultrasonic tip. Okay. What about the angulation of the tip? It can be single angulated or multiple angulated. Okay. For example, these are the Pro Ultra tips from Dent Supply. You can see that the set is about 8 tips. Number 1, 2, 3, 4, 5, 6, 7, and 8. From 1 to 5, you can see that they are silver colored, and the purple and the blue and the green tips are 6 and 7 and 8. From 1 to 5 are stainless steel tips. Stainless steel tips. 6, 7, and 8 are nickel titanium tips. Okay? As you can see, tip into 1 ends with a round bear, like a round bear, used for refining the access cavity and looking for the MB2 or removing a post. Endo 2, as you can see, it is a pointed tip. Ends 3 and 4 and 5. As we go to number 8, you can see that the tip becomes longer, so we can use it in instrument removal inside the root canal. Okay. What about the coat? Are they coated or not? They are coated with zirconium nitride. As you can see here, the tip here is coated with zirconium nitride. What about this tip? This is a tip from Buck BUC. As you can see, this is the diamond coat. This is the difference between the zirconium nitride coat and the diamond coat. As we see, The coat here is for increasing the efficiency of cutting. Here's the CBR tips from Obtura Spartan. From 1 to 5 are stainless steel with zirconium nitride coating. 6, 7, and 8 are nickel titanium tips with zirconium nitride coating. 6, 7, and 8 are used for instrument removal as they are thinner, and more flexible for removing the separated files from the canals. Here are the PL tips from Biotech. Here the active part is not a coat, it's a micro projection. Like you can see here, micro projection. These micro projections are the active part of the tip. They are acting for cutting into the dentine, okay? These are the buck tips, as you can see here. Buck 1, 2 are diamond coated. 2, 3, 4, and 5, they are diamond coated also. The most common tips in the market are the Action or the Cetallic ultrasonic tips. You can find here the first one with a diamond coated rounded tip, and the second with the diamond coated chunk of the tip, ultrasonic tip. And these are the surgical or the retro tips used for the retro preparations. Here are the longer tips that are used for removing the separated file and locating the MB2 or the mesial canal. These are the most common tips in the market. Also, one of the most common tips here is the Start X ultrasonic tips, which are excellent in cutting. They are very active and have a very cutting efficiency, high cutting efficiency. There are 5 tips, as you can see here. Tips with micro milled active board. The active board here is milling. We speak about the coat, diamond coat or zirconium nitride coat, or micro projections, and you can see here milling of the active board. Start X number 1 for access cavity wall refinement, number 2 for MB2 scouting, number 3 for canal opening scouting, number 4, which end with around the tip, metal post removal, and number 5 reveals the original pulpit chamber floor anatomy. Very effective tips, but they are very expensive. These are the tips from NSK. So, guidelines for use. How can I use ultrasonic tips? How can I use them in endodontics? Number 1, you must use ultrasonics in a light touch and be kept moving during use. You must use ultrasonic tips in a light touch or with a light touch, as excessive force significantly use the displacement amplitude of the tip. Ultrasonics are moving like this. You cannot see the vibrations, but I imagine with you how can they work. Okay, they are moving like this. When they face a surface, the amplitude or the vibrations decreases, so the effect decreases. Okay, number 1, using with a light touch. Number 2, using in the recommended or at the recommended power setting by the manufacturer. As when you use the tip in a higher power setting, they results in greater heat generation, which can cause damage to the inter or the periodontal ligament. And also, you must use the tip intermittently. Do not use a continuous use of the tip, as you can cause heat generation and you can force the tip to be broken inside the pulpit chamber or inside the canal. Intermittent use, using the tip at the recommended power setting, using with a light touch. Okay. Heating the temperature beyond 47 degrees Celsius will cause damage. So use it with coolant, intermittent use at the recommended power setting, and do not never force the tip inside the canal or inside the pulpit chamber. Okay. The most important part in our lecture is the applications of ultrasonics in endodontics. Okay. What about the application? access, instrumentation, irrigation activation, removal of intracanal medicaments, obturation, gutta-perca removal, MT adaptation and removal, post removal, either metal or fiber post, removal of separated instruments, apical microsurgery. So we can use ultrasonics in all the steps of endodontic therapy. Okay, in all the steps, from access to retreatment and surgery, Okay. What about ultrasonics in access cavity preparation? Can you see here in this photos? You can see here the conventional handpiece, and you can see here the ultrasonic tip. What is the difference? The ultrasonic tip here is very, very smaller than the conventional handpiece, so I can see well. This, we are talking about the visibility. What about the accessibility? Here also the conventional handpiece limits the visibility and the accessibility, unlike the ultrasonic tip. What about the cutting? The conventional handpiece with the stones or bears are cutting gross cutting. Their cut is gross cutting. What about the cutting of the ultrasonic tips? They are precise, very accurate cutting, and you can control the cutting. Okay, so ultrasonics are very, very important and better than the conventional handpieces. So what are the uses of ultrasonics in access preparation? Number one, for the gross removal of dentine in an access preparation, identify, isolate, and remove the pulp stones and the calcifications, unroofing of the pulp chamber, smoothing of the canal walls of the pulp chamber walls, and finally locating calcified canals. Okay, it is very, very important in locating calcified canals. As you see here in this photo, this is the pulp stone removed by ultrasonics. Here in photo A, you can see here the roof of the pulp chamber. The roof was removed by the ultrasonics, and we can find here the middle mesial canal. You can find here also the unroofing here, and finding the middle mesial canal. Here the maxillary second molar. You can find here the mesiobuccal and the distobuccal canals after ultrasonic application and removing the pulp stone. Here also the mandibular molar by removing this dentine shelf between the mesiobuccal and the mesiolingual canal. You can find the middle mesial canal. Here in this video, you can see the MB2 detection. Also, this is the example for the middle mesial detection. Pro Ultra tips. Okay. As you can see here in this video, ultrasonic tips here are very, very important for removing the necrotic pulp tissue in the isthmus between the buccal and lingual canal of a premolar. There is a necrotic tissue between the buccal and lingual, as the upper premolars have a long isthmus or the long trunk between the buccal and lingual or palatal canals. Applying the ultrasonic tips here, removing the necrotic pulp tissue from the isthmus. Can you see the isthmus between them, or the trunk between the buccal and palatal orifices? very clean gap between them. Okay, what about locating the calcified canals? As you see here in this diagram, you can see a recessed pulp here, calcified pulp chamber, and recessed root canal, calcified root canal here. We can deal with this calcification by using the surgical stent, a guided access cavity, and using the ultrasonic tip here. As you can see here, the ultrasonic tip is very precise, very thin, without perforations, without overextensions. They are very, very important. Okay. So let's go to the next step, the ultrasonic instrumentation. Can we use ultrasonics in cleaning and shaping, mechanical preparation? Yeah, we can use it. Martin et al. Showed that ultrasonic energized file was able to remove more dentine than the same file used by the hand instrumentation. So how can we use them? You can use the ultrasonic tip with the file attached to it in a single tip, or like this, the E1 tip, and you can screw in the file into the tip and use it as ultrasonic file adapter. But there are a lot of disadvantages of this technique. Number one, this technique creates a lot of irregular canal shapes and straightening and transportation. Also, you need to enlarge the canal manually by hand files, file 10 and 15. You must prepare the canal manually before using the ultrasonic files. Also, there is a lack of ductile sensation, the risk of file fracture if the tip become bound during use, and it is a very, very time-consuming technique. So we do not recommend using this technique in cleaning and shaping. The very, very important part of the application of ultrasonics in endodontics is the passive ultrasonic irrigation, or the activation, or the ultrasonic activation of irrigant. As you see here in this diagram, you can see that the touched areas, the red color here, is about 35 to 40%. These are the touched areas of the root canal system by the files. You can see that 35 to 40% only touched. What about the 60%? The remaining 60%, they are not touched by the files. So the irrigation here played a very, very great role in disinfecting these areas. Passive ultrasonic irrigation is a very, very recommended to enhance the effect of the irrigant and enhance the penetration and enhance the bactericidal effect of the irrigant and enhancing the smear layer removal. So what are the benefits of passive ultrasonic irrigation? Allows irrigant to penetrate root canal complexities such as lateral canals and the isthmus, remove significantly debris and the smear layers through gravitation and acoustic streaming, and finally removes the vapor lock. The vapor lock here is the vapor remaining here in the apical 1/3. Air bubbles are remaining in the apical 1/3, preventing the irrigant from penetration to the apical 1/3. So you must remove this vapor lock to allow the irrigation to penetrate into the apical 1/3 and disinfect the apical area. Okay. The passive ultrasonic irrigation is very, very important to remove this vapor lock. Okay. Also, the ultrasonically energized irrigant is effective in debris removal as it goes about 3 millimeters beyond the file, unlike the non-activated irrigant, which can go only 1 millimeter beyond. Okay, the ultrasonically energized irrigant can go 3 millimeters beyond the file, so you can go deeper and disinfect deeper. The smaller also the file, the larger the displacement. As I told you in the first slide, vibrations, when the file becomes smaller, the larger is the displacement. When the file becomes smaller, the larger the displacement. When it becomes larger, the file, the displacement becomes less. Okay? When the vibrations are increased, the effect of the ultrasonic tip of the file increases. As much as possible, the ultrasonic file needs to be able to oscillate freely, as binding the file into dentinal walls or friction with the walls decreases the displacement and decreases the effect and decreases the cavitation and the acoustic stream. Okay, so let the file oscillate freely inside the canal. Choose a smaller file, smaller than your preparation. The file or the irrigation can go 3 millimeter beyond the end of the file. Okay. Okay, what is the time of activation? Studies varied from 8 to 10 seconds per canal up to 1 minute per canal. Okay, 1 minute per canal is very, very good. We can use the ultrasonic file adapter for activation, as you can see here. Nowadays, there are a lot of ultrasonic activators like the Ultra X by ETS, the Endo Ultra by Micromega, the Ultra Smart by Coxo, and the Ultra Max by Rogine. There are a lot of devices for ultrasonic activation. They are very, very useful in passive ultrasonic irrigation. Okay, you can use any of them. Their tips are very, very flexible. You can use the tips and you can bend the tips. They can take the shape of the canal, but take care with these tips. You can form a ledge or transportation if you overuse these tips. This is a video comparing the sonic activation with the ultrasonic activation. You can see the sonic by the endo activator. The video by Dr. Filippo Cardinali from Italy. What about ultrasonics? Great. Great effect. Okay. Photographs showing the effect of passive ultrasonic irrigation using the airy safe tip. This is called the airy safe tip. This tip is from Action or Satellite. The airy safe tip. It can be in 20 or 25, size 20 or 25. Okay. Also, there is a trick in using. If you don't have an ultrasonic tip, you can apply the probe here. If you have an upper central incisor, wide canal, you can apply the endodontic explorer and indirectly activate the probe. Okay, you can activate the probe using the ultrasonic tip for scaling, and you can apply it in the canal. What about continuous ultrasonic irrigation? Continuous ultrasonic irrigation is a way of BOI or passive ultrasonic irrigation, but with continuous application of the irrigant, with continuous replenishment of the irrigant inside the canal. A very, very useful way to continuously refreshment of the irrigant inside the canal. Number 4, the fourth application of ultrasonics in endodontics is for removal of intracanal medicaments. As you can see here, calcium hydroxide can be removed easier by using the ultrasonic activation of the irrigant. It will wash it easily from the canal. Of course, using alkylating agents such as 17% EDTA or 10% citric acid with passive ultrasonic irrigation will increase the removal, the efficacy of removal of calcium hydroxide. Okay, so to enhance the removal of calcium hydroxide intracanal medicament, you can use EDTA with BOI, with passive ultrasonic irrigation. What about obturation? Can we use the ultrasonics in obturation? Yeah, of course. Of course. Number 1, for the sealer adaptation, the use of ultrasonic energy for application of the sealer results in a more thorough and even covering of the root canal walls. Okay, it helps in the distribution and the application of the sealer inside the canal. Okay, number 2, for Guttapercha compaction, as I said, ultrasonics, when they get friction or get touched by any walls or Guttapercha, they produce heat. Okay, this heat can soften the Guttapercha and cutting it and condensing the Guttapercha. Also, you can sear off the master cone at the orifice using the ultrasonic tips. Okay. What about retreatment? Guttapercha removal. Of course, the same concept. Ultrasonics produce heat. This heat can soften the ghetto burqa, and the ghetto burqa will be displaced coronally. Okay, it is very easier, but just we can use it coronally. We cannot depend on the ultrasonics in a deeper areas, just coronally. Of course, application and adaptation of MTA. The indirect ultrasonic activation has been suggested for use to vibrate the mineral trioxide aggregate. The indirect activation. I will show you a video of the indirect activation of MTA. I will show you a video now. This activation will improve the adaptation, decrease the voids, improve the marginal adaptation, improve the compressive strength of MTA, improve the resistance to bacterial leakage. Let's see the video. And see here he is applying the MTA inside the canal, and he will activate the plugger indirectly by the, as you can see here, indirect activation. You can activate the plugger by the ultrasonic handpiece. Okay. Okay. Also, ultrasonics are very, very helpful in the removal of MTA. It is helpful in adaptation and application of MTA. It is very, very helpful in removal of MTA. In failed cases, like the MTA pulpotomy, how can I remove the MTA? By the handpiece or the ultrasonic? Here, the ultrasonic is very, very useful. Also, the MTA obturation or obturation by boroceramic sealers, the ultrasonic here are very, very useful. You cannot negotiate the canal with the files through the bioceramic sealer. You can use the ultrasonic tips for removing the sealer. Also, failed MTA plug, you can remove the MTA plug by the use of the MTA of the ultrasonics. MTA regeneration also, we can remove the MTA coronally by the ultrasonics. Okay. Number 8, post removal, either metal or fiber post. Of course, ultrasonics are very, very important in post removal, either metal or fiber post. How can we remove post? As this video. Yeah. Okay. Okay, first he used the ultrasonic tip with the rounded tip to loosening of the metal post in a counterclockwise motion. Counterclockwise motion. Number 1, counterclockwise movement or motion with cooling. As friction with the tip and the post generates heat. This heat is very, very harmful to the periodontal ligament. So we must use a coolant with the ultrasonic tip during post removal. After removing the post, you will remove the cement around the post, the remaining cement into the canal by a thinner ultrasonic tip to enhance the canal cleanliness, and also to remove any remaining cement which could obstacle me to get patency inside the canal. So what are the factors affecting the most removal? What are factors affecting the post removal? Number one, the depth of the post into the root. Of course, the deeper the post, the harder the removal. Of course, the deeper the post, the harder the removal. Of course, what about the type and the design and the material of post fabrication? Of course, the threaded is harder than the smooth. Okay, the tapered is harder than the parallel. Okay, the type of the tooth in which the post is cemented. Thus, anterior teeth is easier than is harder than posterior. Of course not. Anterior is much easier than posterior. The luting agent used, whether it was a resin, adhesive resin cement, or just a glass elastomer cement. Of course, it affects the removal. The extent of the coronal assembly, of course, it affects the extent of the leakage before the post removal. Of course, when the leakage extends beyond the post, it becomes easier for removal. So, what time should I have to remove a post? About 10 to 15 minutes. 10 to 15 minutes. If you spend about 15 minutes in removal and the post didn't become loose inside the canal, you should use a different post removal method, or you should use a longer ultrasonic tip or a thinner ultrasonic tips to remove the cement deeper around the post. So when you spend about 15 minutes in post removal and the post didn't become loose, so you must use a different post removal method, or you can use a long ultrasonic tip which can go deeper and remove the cement around the post. Okay. What about the risks of post removal? Ultrasonics exert a lot of stresses around the post, and on the dentine surface, you can cause cracks during vibration. Of course, you can increase the chance for cracks if you use a high power setting, if you use a non-coolant system, if you apply a great pressure on the ultrasonic tip to remove the post, you can cause cracks. Also, production and the conduction of heat can cause necrosis to the periodontal ligament. Number 9, the removal of the separated instruments. Here in the ultrasonic tips, you must use the magnification microscope in removing separated instruments. Can you hear the sound of the video? Can you hear the sound of the video? Okay. Here in this video, or this animation, using magnification is very, very important in removing the separated instrument. The steps of removing separated instrument includes the formation of a platform over the broken file or the separated file, then going with a very thin ultrasonic tip around the file in a counterclockwise motion or motion. This counterclockwise is able to loosen the file inside the canal. Also, you can go for using ADTA or olive oil for facilitating the removal of the file. When you are removing a separated file, you must not use a coolant within the ultrasonic application. So as you can see the file, the broken file, as irrigation will hide you from seeing the file, okay, will prevent you from seeing the file. So it is very, very important to not using irrigation during separated instrument, just application of the ultrasonic tip 1 or 2 minutes, then cooling separately by air coolant. Then after that, you can dry the canal with the stroke irrigator or by paper point, then using the ultrasonic tip again to avoid excessive heating during the use of the ultrasonic tip. Okay. the removal of separated instruments. Ultrasonics can alone remove segments less or equal than 4 millimeters after doing the platform and exposing 1/3 of the file. Not on all the cases, but in certain conditions. In certain conditions, ultrasonics alone can remove these segments, which are less or equal 4 millimeters. When they are longer 4 millimeters, you need ultrasonics in addition to a grasping tool, like an extractor or a pin or a tube technique, and a lot of methods for grasping the broken file. Okay, ultrasonic tips, as I said, are used for 1 to 2 minutes to remove the fine file fragments. A significant increase in temperature can cause injury to the periodontal ligament and bone. So you need intermittent cooling between the use of the ultrasonic tip inside the canal. Okay. Ultrasonic tips are used without coolant for better visibility. During application of the ultrasonic tip for removing the broken file, use them without cooling. Okay. What about apical microsurgery? Can we use the ultrasonics in apical microsurgery? Of course. Of course, as we said, ultrasonics can be based on the piezoelectricity. Here, the piezotome or the piezo device can be used to remove the bone or the bony defect, or can be used to remove the apical part of the root, which is called the episectomy. We can do episectomy and bone removal, or the osteotomy by using the piezosurgery, which is based on ultrasonics. Okay, what is the advantage of piezosurgery? Selective cutting without damage, little residual debris, less bleeding, and minimal trauma, and excellent post-operative healing. Okay, what about using the ultrasonics in the retro preparation? Okay, we did the episectomy first by the piezotome, or either by the burr or the surgical burr. Then we can go for the retro preparation. This is a conventional technique by using the burr, and this is the modern technique by using the ultrasonic tips. Ultrasonic tips in retro preparation results in higher quality conservative preparation with fewer occurrence of perforation, like the burr preparation. Okay, the traditional method of episectomy causes a very high incidence of perforation with a low quality of preparation. As you see here, the burr here is not centered inside the root canal, and you can see the ultrasonic tip is centered with the long axis of the root with a very, very conservative way. What about the microsurgical ultrasonic tips? What about their design? It has multiple angles. As we go inside the root, from after we raise the flap, you have to be accessible and suitable for preparation. So the tip should have multiple angles, like you can see here. These multiple angles allow better accessibility for preparation. What about the cutting tips? In the episectomy, after episectomy, we should made a retro prep about 3 millimeters. You can see tips ranging from 3 to 7 or 9 millimeters. This tip is 3 millimeters. This diamond coated tip or a non-coated tip, a diamond coated or non-coated tip. Okay, they can vary in the cutting tips from 3, 5, 7, or 9 millimeters or 6 millimeters. They can be with water port or without water port. As you can see here, that is tape from Satalic AS 3D, 3 or 3 millimeters D diamond coated, 3 millimeters diamond coated, 6 millimeters and diamond coated, 6 millimeters and diamond coated. As we go posterior, these for the anterior teeth, as we see here in the Pro Ultra tips. The Pro Ultra tip number 1 and 2 are for using them in anterior teeth, upper and lower. As we go further, you can see here the increased angle of the tip for better accessibility. Increase the angle here. Here the increased angle of the tip. Also, the tip this tip is for the right and this for the left. As a posterior, you can multi-rooted teeth. It's very, very important to select the most suitable tip. You should use these tips in a low power setting, a very low power setting, so they can cut very precise without perforation or increasing the chance of having cracks after preparation. This is the KIS micro tips by Optura Spartan. As you can see here, this one is for the anterior, this one and this for posterior with increased angle, angulation, increased angulation for the posterior and more accessibility for cutting or for preparation. These are the CT tips from Cybro Endo by Dr. Gary Carr in 1990. Very, very old school. Here the preparation using the piezo surgery. This is the piezo tone by Dr. Andrew Pereira. You can remove the bone here by using the piezo electric device. Very conservative cutting. As you can see here, the retro tip diamond coated is diamond coated about 3 millimeters, used for doing the retro preparation. Very concise with a very high quality preparation. Then it is ready for MC application. Okay, what is the side effect or the drawback of ultrasonics and retro preparations? The dentinal cracks. Using the ultrasonics in doing a retro preparation may cause cracks, which promote healing and perhaps resulting in fear of microsurgery. Cracks are very, very common when you use high power settings than the low power setting. Okay, you must use a low power setting during preparation to decrease the chance of cracks. Of course, the stainless steel tips are can cause cracks than the diamond coated tips, as the stainless steel tips are difficult in cutting, so they exert a lot of stresses over the file, over the root, and they can cause cracks. Unlike the diamond coated tips, which can cut easily without excessive friction and excessive stresses over the root, which can cause failure. So thank you so much. Thank you so much. I hope the presentation was good and you liked the lecture. I hope you get benefit from it. And ultrasonics really a very, very nice topic to lecture about. So I am ready for any questions, Vincenzo. Any questions?
Yes, I mean, very good presentation.
Thanks so
very,
much.
very interesting topic, really. Ultrasonics,
Thanks
I
so
think,
much.
are very, very important in our practice. Are the 50% of the endodontic treatment. I have two questions. The first one is about acoustic streaming. You talk about acoustic streaming, and I'd like to know, in your opinion, which tips are better to reach this type of notes between each millimeters of the tip. For example, you showed the tip of Dentsply, Sirona.
Pro Ultra tip.
Exactly, that is nickel titanium. Tip, yes. And in your opinion, which tip is better to reach this effect, this acoustic streaming?
You should use a very, very small tip as much as possible. Very, very small, so as amplitude of the power of the ultrasonic energy can be translated into the tip. You should use the very, very light touch when using this tip. You can use the file, the AirSafe file. The AirSafe file is very, very thin, but avoid friction or binding the file within the dentine, as it is very, very fragile. It can be broken easily. Also, the tips for you can use the tips with Satalic or Actune. They made the tip not the air safe. They can
Yeah.
they have a tip for irrigation. Also, you can use a file adapter also with a smaller file in it. You
Mhm.
can use a ultrasonic file adapter with the file 15 or file 20.
Yeah.
There are a lot of options, but the main concept is using a smaller diameter with a small taper.
To
Smaller
don't
diameter with a small
touch
taper.
walls,
Yeah,
dentin
yeah.
walls, right?
So
Okay.
it can oscillate or vibrate inside the canal freely without
Exactly.
binding with any walls.
Perfect.
Yeah,
And the second one is my questions is about the eating of dentin walls, because you talked about necrotic ligament that you can cause the necrosis
yeah, yeah,
of the, yes, of the periodontal ligament.
yeah.
Um, this this type of effect inside of the periodontal ligament can end with a resorption defect of the root, or with an ankylosis, in your opinion? Most of cases will fail, for example, if you don't use correctly your tips during the treatment.
Of course, when you use
Exactly.
tips
Yeah.
in a wrong way, you can increase the external temperature of the surface, the
Yeah.
temperature of the external root surface, and you can cause necrosis of the periodontal ligament, which can increase the chance for ankylosis and root resorption.
Yeah.
Intermittent cooling is very, very important. Using the power setting by the manufacturer is very, very important. Also, do not exert a lot of stresses over the tip. Be in the tip or apply the tip for just maximum 2 minutes inside the root canal. Then cooling. You can use the strop corrugator for cooling between them. Very, very
Yeah.
useful way. Uh, that's it. I think that's it. Very, very
Very,
useful ways
it's a
to,
very good tip, yes,
yeah,
to use the Stropco irrigator
yeah,
to cooling, yes, the tip,
yeah,
or sometimes I cool the tip with the air spray while I'm using it without water, because with water, in most of time, the power of the tip is less.
yeah,
Without
yeah, yeah.
water is, yes, is more, as you told before.
Also,
Yeah.
regarding the use of the stroke, you must not use the stroke for air cooling when you have
Yeah.
a patent canal. Okay, as it may cause emphysema or accident.
Exactly. A
Okay,
very large, yes, a very
yeah, yeah.
large canal, for example. Yeah. We have a question.
Okay.
um, is it easy to use the ultrasonic device that use it in scaling?
Yeah, very, very good question. In
Yeah.
my clinic, I can use the
Hmm.
scaling tip in axis modification, in canal negotiation, searching
Yeah.
for hidden canal like the MB2, the middle mesial. Very, very helpful tip, the scaling tip. You don't have to buy a very expensive tip for axis modification. This is a very, very cheap way for searching for the MB2 or locating a calcified orifice. You can use it, and it is very, very good option.
For, yes, for searching MB2, I like a lot
Yeah, yeah,
the
yeah,
Smart X three number three tip. I think
yeah, yeah,
is useful in, yes, in an
yeah, yeah.
MB2
Also,
scout. Yeah.
the Start X tips are very, very good in removing the fiber
Start X,
post.
yes, not Smart.
Yeah,
Yeah.
yeah. The
Yeah.
Start X is very, very
Yeah.
good in removing fiber posts. You can drill
Exactly.
through the fiber post. You can drill
Exactly.
through it.
As you show in the in your video, is, yes, number four tip is useful to
Yeah,
move without provoke any crack
yeah, yeah, yeah. Very high
during the root.
cutting
Yeah.
efficiency. Very good cutting efficiency, and they
Exactly.
are
Exactly.
very, very active with the water port also for
Yeah.
cooling. You
Yeah.
can use them to remove the fiber poses and also for the metal poses, especially the tip number 4. Very, very good.
Perfect. Thank you for your amazing presentation.
Thanks, bro.
And
Thanks.
I only have to read some new information.
Okay,
So I share my screen,
okay,
and I will share with you your certificate of appreciation.
okay,
Thank
bro.
you, thank you,
Thanks so
bro,
much,
for
bro.
your amazing presentation.
Yeah, yeah. It was
Hope
my honor to
that
be with you, bro.
thank you. Okay, this is your certificate of appreciation for
Thanks
the
so much.
valuable scientific contribution in our online conference.
Thanks so
And
much, bro.
thank you to all members to join our group, and hope they use your useful uh, tip in everyday practice. I think you rock the stage, and hope many
Thanks,
dancers
bro.
can learn the how to do endodontics in the safest and best way.
Yeah, yeah.
Okay,
Thanks, bro.
you're welcome. You're welcome. You did it well. We have the last question. Then I leave you from
Okay,
Prof. Latifa.
okay.
It's what about ultrasonic activated irrigation versus laser activated irrigation? I think it's a very nice question.
Yeah, yeah. Very nice question, Dr.
Yeah.
Latifa. Mainly, the most commonly used activation method is about sonic or ultrasonic. The
Yeah.
laser, I think, it is just limited to the research work. I read about a review article about the laser activated irrigation and
Yeah.
different method of activation. It's a very, very good method. Uh, but I think يعني, it is limited to research work.
Yeah.
Um, I saw a video about the laser activated. Is very, very wonderful, wonderful activation method. I hope to use it in the future. Of course, I will read about it more and more, and to be evidence based about it, and to prefer either the ultrasonic or the laser
Yeah.
activated hearing. Okay.
Perfect. Thank you
Thanks,
a lot, Dr.
thanks, Dr.
Hikoli.
Latifa. Thanks so much.
Thank you so much for your nice webinar. So thank you all members, and
Good night.
we will see in our next lecture by Dr. Brecht Gilbert.
Yeah, yeah.
Um,
I think it will be a very good webinar.
a very, of course, we will.
Yes, yes. He's a very, very amazing endodontist.
Exactly.
Yeah, yeah.
Thank you all.
Thank you. Good
Bye.
night. Good
Good
night. Bye
night.
bye.
Good night, all. Good night.
Bye bye, bro. Bye bye. Bye.
Bye, bro. Bye.